Hi, my name is Letitia Peters and I'm going to be doing my poster presentation for my BSN capstone project. All right, so let's do a little bit of an overview for the poster. Poster is a great way to see the little bits and pieces of the project that is put together as a whole. I really enjoy this slide because you can see just everything put together, all these little pieces into one big piece. So there's a nice little overview of the project. So let's look at it a little bit more in depth. I want to talk about the background of the reason why I focused on chlamydia. So before, when I became a new nurse, I've been a nurse for approximately, almost 30 years. So it seemed like before patients focused on staying safe as far as using safe sex practices, limiting the number of partners they had. They cared about contracting a STI. Providers were educating and testing patients more regularly. Everything was more important, it seemed. So what's interesting about this is the importance is lacking. It shows that CDC 2021 notes that the rate of chlamydia in 2019 was 1.8 million people in the United States had chlamydia, which is an increase of 19% from 2015, which led me to do my research on the increased rates of chlamydia and why that was occurring. So my PICO questions is as follows. In adolescents/young adults with focus on ages 14 to 30 years of age, is the chlamydia infection rate for those patients with healthcare providers who make testing and education a priority lower than those patients with healthcare providers who do not make it a priority? Well, I wanted to further understand the increase and why. So my aim of the study was what has caused I want to understand this, what has caused the increase in chlamydia, and I wanted to think about and do a project study and include people in my practice on how to intervene. So basically we did a design, and the design of the study, basically I did some qualitative research and some quantitative research. Quantitative research is using numbers, and that's kind of about the number area of this research. And then qualitative is more like reading people's thoughts, words, reactions, other studies. So it's a bit of a mixed method. And I had two types of research: primary research, in which I conducted a study with my local practice and local patients. And then also there was secondary research, in which I definitely researched and did read other people's research regarding this subject. So interventions, let's talk about this. So Lorch et al. Noted that providers that were re-educated regarding chlamydia and STI testing were more apt to increase testing of their patients. So how do we want to make a change in our local practice? How do we want to make a difference in our community? That is by re-educating our providers to increase testing, increase educating of our education of our patients. So Wood et al. 2021 noted a study in which testing increased 11.6% when providers had reminders of the impact of STI testing, chlamydia testing, and reminders to do so. Well, it's interesting enough that, the education out there for patients is basically not very in depth. It's not very frightening. John Hopkins, who's a leader, Hopkins is a leader in medical education. John Hopkins 2021 notes chlamydia is spread from different forms of sexual contact, and that people should be tested yearly if their provider wants. Well, it should impact the patient. It should have more of a statistic, so when you should be tested, with new partners, new pregnancies, with basically your yearly, if you're not in a monogamous relationship. But even then, you could have a partner that may not be monogamous. So maybe just yearly testing period, and then increased testing with a partner change. So the interesting thing too is that WebMD 2019 promotes barrier use, only that the fact that they focus all the education on HIV. So everybody else, they're thinking, well, I'm not going to get HIV. That's something huge. And it doesn't really focus on the rest of, STIs and testing. So we need to re-educate our patients. We need to re-educate our providers. We need to make a poster / handout to re-educate patients, to re-educate providers, to note the impact of this disease. So we also need to improve our practice guidelines, increase testing, give our nurses more autonomy, do more nurse visits, allow them to have standing orders to do testing. We need to do something. It's very interesting, as this chart shows that Statista notes in 1985 there were 17.4 cases of chlamydia per 100,000 people per capita. The 2019 number increased to 552.2 people per 1,000 per capita. That is a huge increase. So what do we need to do? We need to make it important again regarding education. We need to make it important to do testing. We need people to understand the importance of this. We need improvement in this education. We need improvement in testing. We need to give nurses more autonomy so that we can do this, and our busy providers, not that nurses aren't busy, but our busy providers will be able to hand that over to nurses. So what are my expected results? So expected results are to when increasing education for providers regarding chlamydia, it will improve testing for chlamydia. And then increasing education for patients may reduce cases of chlamydia, because people may start practicing safe sex again. They may limit the number of partners they have again, and they may limit, or not limit, but maybe they will get tested a little bit more. We just need to do something. So education, testing, these will decrease our numbers. So what are we going to do? We are going, those increased numbers, we're going to re-educate. Again, we are going to give nurses more autonomy. We are going to re-educate our patients. Knowledge for our patients and our providers is power. And with all of this, we are going to increase our success, lower our numbers, increase our success of lowering the numbers of chlamydia, making an impact. So, no, we never stop learning, never. So we are going to test, we are going to educate, we are going to share. If we're successful, we're going to share our best practices with others in our community, other providers. The rates are going to go down. The other providers are going to share with their colleagues, and their best practices are going to be shared. Hopefully we can make a difference on our community as a whole, and then maybe this will be spread to the state as a whole, and then the nation as a whole, and globally. We need to do something. So if we do all of this, I know with education, with testing, we can definitely make a difference. So in conclusion, if we pay more attention, if we take the time, if we educate our patients, if we test our patients, our numbers will go down. Thank you so much for listening to my presentation.